I'm Jennifer Kiefer. I'm a bachelor's in nursing student at the University of Texas in El Paso, and I'm doing this video for Nursing 4503. The aggregate community that I chose is in Woodway, Texas. It's a 20 block radius around Premier ER, which is where I work. And it is mostly Caucasian. There are some, and the next is Hispanic, and there are some African American and Asian families as well, and it's well integrated. In 2017, the population in Woodway was 8,825 persons. There's only a 5% poverty rate. The houses in the neighborhoods are all in good condition. The yards are well manicured. There's churches. There's parks in the adjacent area, but no parks in my 20 block aggregate community. And there are signs showing community involvement, church picnics, the Woodway community night out. So they do, the community does participate. One of the community resources for this area is the Waco-McLennan County Public Health District. There's programs and services for the public. Your ability to pay does not affect whether you can receive services from there. These are some things that I discussed with Margaret Cowart. She is the nursing program director for the McLennan County Public Health District. The fact that they help the uninsured and underinsured of McLennan County. They're federal and state funded. They have coalitions with the United Way and Waco Foundation and a few other charity foundations in the area to help fund them, and it's for residents of Waco and McLennan County. My face-to-face interview was with Laurel Churchman. She is the program manager of the STD and HIV clinic at the McLennan County Public Health District. Laurel did let me know that they provide STD prevention and education and testing as well. A lot of times there's no charge for that. Sometimes there is a charge. It depends on your income. If you have Medicaid, then you don't have to pay at all. They do free HIV testing regardless of whether you have $1 million or no money. And then they do HIV referrals. They don't do any treatment, so they refer you out to someone that can help you take care of or manage your HIV. A primary prevention at the Waco McLennan County Public Health District. They do immunizations, sometimes free or at very low cost. And then they have a ton of information on chronic disease prevention, obesity prevention. The WIC offices at at the public health district. They have a tuberculosis clinic, and as I said, they have an STD and HIV clinic. And they also have information about public health preparedness. So it's a really good, incredible resource. A secondary prevention in this area is the Waco Center for Women's Health. You can get your pap smear there. They do birth control, any kind of women's health issue they can take care of there. Um, they do prenatal care, and they can refer you to get a mammogram so that um, to keep up with your health, with your breast health there. A tertiary prevention in this area is the Providence Cardiac Rehab. They treat patients who have had a myocardial infarction, recent cardiac surgery, coronary artery disease, congestive heart failure patients, and patients that are at high risk for coronary artery disease. They help you with lifestyle changes, and they help patients who have had an acute MI or cardiac surgery, help them regain help them rehabilitate so that they can get back to their lives. Perspective of value for the Waco-McLennan County Public Health District. They do offer good and credible resources. Your ability to pay is not a factor. They have many health resources. They have topics on their website that are very informative and can educate you on many different things. They help the impoverished, the uninsured, and the underinsured. And they do have some treatments there as well as referral service. I would definitely recommend this agency to anyone who needed it. Even if you're not uninsured, underinsured, if you're going out of the country for a mission trip and you needed a specific vaccine that your doctor's office couldn't get, this would be the place to get that, or the place to help you figure out where to get that. The first website that I reviewed was the Texas Department of State Health Services. That's located in Austin, Texas. Their primary prevention services that they offer are immunizations, information on mosquito-borne illnesses, and that is huge here in Central Texas. STD prevention, HIV prevention, chronic disease prevention, obesity prevention, maternal and child health, and they have information on quitting smoking. Secondary preventions at the Texas Department of State Health Services website. They have STD treatments, tuberculosis treatment and referral, HIV referral, and they also offer medication assistance. If you, even though they refer you out if you test positive for HIV, they refer you to an infectious disease doctor. They will help you get your medications because those can be really expensive. They do that for tuberculosis and hepatitis as well. Perspective of value for the Texas Department of State Health Services. They do provide credible resources to residents of Texas. It's somewhere that you can go and know that you're getting true. It's not like Googling something where you're not sure if it really is what it says on the website. This website is credible. They have their availability of services is not based on whether you can pay or not. That doesn't matter. They do promote a healthy lifestyle. They promote being disease-free, tobacco-free, obesity-free, and they have education, prevention, treatment, and referrals. I would recommend this website to anyone who needed it. The website was very easy to navigate. As I said, that it is valuable and credible information that you're getting. It's kept up to date, and then there's information on a multitude of topics. The second website that I reviewed is the Family Health Center website. Family Health Center is it's a group of attendings and residents. They have several facilities around this area. They help you establish primary care services, so you can get primary care treatment there, disease prevention, immunizations, women's health. They have imaging services. You don't have to go somewhere else to have your images done. You can get it done through the Family Health Center, even if it's not at your actual clinic that you go to. Referral for mammograms for women. They do accept insurance, Medicare and Medicaid, and they have a sliding fee scale for those that are uninsured or underinsured based on your income. Secondary prevention at the Family Health Center website. Disease management, if you're already chronically ill, they do manage your disease. They offer acute illness treatment. If you have a cold or fever, you can go there and get treatment. They manage inpatient hospitalizations. If you're admitted to one of the 2 hospitals in town, and you're a family health center patient, one of the residents actually takes care of your treatment while you're there in the hospital. They do manage labor and delivery patients at one of the hospitals, but at one of the hospitals, they don't do labor and delivery patients. Perspective of value for the Family Health Center website. They help indigent and low-income residents in McLennan County. They help you to establish primary care so that you don't have to go to the ER or an urgent care every time you're sick. They help the uninsured and underinsured. They do promote health, and they promote improving the health of the community as well. I would recommend this agency to anyone who needed it. They, as I said, give information on establishing primary care. Their services are listed on their website. There is quite the amount of information on their website. And then their phone number is there if you have more questions. They have many services offered, as I said, imaging, laboratory services, and you can make an appointment from the website, or you can click on a button where they will actually call you to find out, you can let them know that you're interested in setting up primary care services, and they will call you. The Family Health Center website, I don't feel like it would help the people in my aggregate community, just because those residents, for the most part, are insured. They already have established primary care, and they have the ability to pay for their health care. Thank you so much for taking the time to watch my presentation. I do hope you enjoyed it, and have a good day.